So this is a poster on the real-world adherence and persistence to emicizumab using a national U.S. claims database. Estimates of adherence to standard of care prophylaxis in people with hemophilia range from 47% to 82%. Approximately 35% of people with hemophilia A receiving factor VIII replacement products are non-adherent, although better adherence is associated with fewer bleeding episodes. Emicizumab is a bispecific factor IXA, factor X directed antibody approved in the U.S. for routine prophylaxis in adult and pediatric patients with hemophilia A with or without an inhibitor. It is administered subcutaneously on a flexible dosing schedule, either once per week, once every 2 weeks, or once every 4 weeks. This poster described the real-world adherence to and persistence with emicizumab prophylaxis in the U.S. population of persons with hemophilia A using a retrospective observational cohort study through an adjudicated claims healthcare claims data from IQVIA Pharmetrics. Included patients were those with an ICD-10 code for hemophilia A between 5/1/2017 and 9/30/2023. They had to have greater than or equal to 2 emicizumab prescription fills, greater than or equal to 2 days apart, the first fill being the index date, and continuous medical and pharmacy insurance benefit coverage for greater than or equal to 6 months before and greater than or equal to 12 months after that index fill. The patients were excluded if they had any ICD-10 code for hemophilia B or another rare bleeding disorder, for example, von Willebrand disease or acquired hemophilia A. Days supply was imputed from the claims with this missing field. Adherence to emicizumab was defined as having greater than or equal to 80% proportion of days covered, which is PDC, during the 12-month period of time after the index case. PDC was determined by calculation of days covered by Emi divided by the days in the period. Persistence with emicizumab was defined as a proportion of patients with hemophilia A who did not discontinue emicizumab within the 12 months of the index date. Discontinuation was defined as a treatment gap of greater than or equal to 60 days per expert clinical input. Originally, there were 19,454 persons identified with an ICD-10 code for hemophilia A. Many of these were excluded in subsequent data cuts due to either not having greater than or equal to 2 emicizumab prescription fills, greater than or equal to 2 days apart. They may not have had continuous medical and pharmacy benefits for greater than or equal to 6 months, or they may have had another bleeding disorder. In the end, there were 280 individuals in the group to be analyzed, which represent 1.4% of the original cohort. Overall, the rates of adherence and persistence were very high across different age groups, ranging from 61% to 97%. Although adherence was lower in the 19 to 30-year-old age group, rates were not different from the greater than or equal to 51-year-old age group. In the 213 patients with hemophilia who were adherent to emicizumab, most had no claims for factor VIII during the post-index period. Persons with hemophilia A had a mean of 1.14 factor VIII claims in the 12 months post-index. The mean number of days with factor VIII claims during the post-index period was 0.79. Claims data only capture medications dispensed during a period of time and do not reflect a home supply of medications or if the medications were actually utilized by the patient, and these may represent weaknesses within the data inherent in the type of analysis that was performed. There may be misclassifications based upon the ICD-10 code, and this data represents commercial health insurance and may not be applicable to other forms of insurance for patients in the United States. Despite these limitations, long follow-up times and the sample size may provide strength to the analysis. Real-world adherence to emicizumab, as measured by claims data, continues to be high with a low discontinuation rate. High adherence and few factor VIII claims suggest that emicizumab was well tolerated and efficacious. The low frequency of factor VIII claims filled during the 12-month post-index period can be correlated with low number of treated bleeding episodes. These emicizumab adherence results are consistent with previously published self-reported adherence results in persons with hemophilia A and caregivers.